All, this is Dr. Mobeen Sayed from drbeen.com. Hope you're doing well. Today, I wanted to talk about children once more in context of the schools being opened. And secondly, there had been some comments about the data that I had been presenting. So I thought that I would look at the data and present it and discuss it with the cool beans over here. I think some of this data that you would see, everybody thinks differently. I would put my stance out first, and my stance has always been that do not put children at risk. That is my stance. I'm not budging from my stance. Having said that, I'm going to show you some data which may actually be contrary to my stance. Still, for me, any one child's death is a tragedy that impacts the parents forever. So I stay with my stance, but I wanted to show you the data that may actually say that the risk to children is lesser. And so I wanted us to all look at it. Then it is totally up to you to make up your own opinion, your own mind, that is this okay for the children to go to the schools or not? Is it okay for them to be exposed or not? At the same time, when some people leave angry comments that I have a wrong stance, to them, my simple question is, do you have children? And if you're advocating that children should be sent to school and be at risk, are you okay? Did you think about your own children as well? Because it is not necessary that it would not be my child who becomes sick. It can be anybody. So with this, let me show this data. And before that, couple of more things as well. I receive a lot of letters like these. So as much as I receive a lot of threats as well and angry comments, I receive things like this. And this is really what pains me. So this is a letter by Janet, and she sent a lot of donation as well. And she said, Dr. Mobeen Sayed, thank you for your wonderful lectures and interviews. I found you on YouTube because my 42-year-old daughter has been, and in quotes, recovered from the SARS-CoV-2 virus for 4 months, but is extremely fatigued. I am hoping that modulation of our complex immune system with something such as leronlimab ? Might someday help her. Janet. P.S. I do not mind your cat at all. One of my friends has a parrot who comments during our Zoom meetings. So this is one area which really pains me, and that is the long haulers. As much as there is no decent protocol that has been accepted, I believe Math Plus protocol is beautiful. I believe hydroxychloroquine and ivermectin and steroid have a beautiful place in the management of the disease. I believe that statins and steroids in the long hauler state are also very, very important, and I have used them successfully on my patients. But it pains me that there are folks out there who are long haulers, and there is not much treatment available for them. It aches me. And the other comment I wanted to read you, this is 31 minutes ago, and this is a public comment she has put on the YouTube video, so I can read it. Her name is Sharon Herson. And she says, I have COVID. I went to my doctor today, and all he could do is try to prove nothing works for COVID. I asked him about the budesonide, and he said it would probably cost me close to $1,000. I panicked. All I have is Medicare. He discouraged me because he didn't believe it would work anyways. I was really let down by this. Doctors are not educated about this. He was more about being right than he was trying to find me some help. Very sad. So this is the other part which really makes me sad, that I believe my observation is not all doctors have kept themselves abreast of what may be the possible treatments. And I also believe that the administrations, their job was, all the way starting from WHO to the local administrations for health ministries in various countries, their job was to figure out a decent protocol. and then to filter it down all the way and send it down all the way to the doctors, instead of making every single doctor's own responsibility to figure out what to do and provide some protocol to them that works. For example, hydroxy works, ivermectin works, steroid work. So I receive a lots of such comments. And it, of course, I've become sad with this because we know things that can help. So with this, let's start. So here I have a few, some data points over here. The very first data point is the comparison of Sweden with Finland. And once again, I keep going back to Sweden because they had kept a consistent approach. That approach panned out correctly or not, but at least we can say that that approach had a consistent behavior, possibly consistent behavior, and we can use that as a learning. And the other thing is, which is interesting for me, if you see here, this is the study. This is called a Nordic Study. This study is done by Sweden's health ministry with Department of Finland. Over here it is written. So this report has been produced in cooperation with the Finnish Institute of Health and Welfare, represented by Dr. Hanna and Dr. Otto, and then the Public Health Agency of Sweden. And what is interesting for me, other than the data that is very interesting, what is interesting for me is that when I usually talk about Sweden and Finland and Denmark and Norway, people tell me that how dare you compare these countries. Even some of the doctors from Sweden who are very close to Tegnell have left comments on my video saying, how do you compare these countries? They cannot be compared. But when it comes to their own health ministries, and when it comes to in an area where it can actually help put their case forward, they went to Finland and compared their data with Finland's data. So, but the data is good. Nothing bad in it that they did it. What they're saying is, and I'm going to show this data out here on the drawings as well, but what they're saying is this report is a comparison between Finland and Sweden, two in many ways similar countries who applied different measures regarding schools during COVID-19. And so let's look at it. What they are saying, the summary of this is they're saying that the number of children getting sick in Sweden were not different from the number of children getting sick in Finland. Finland was in lockdown, Sweden was not. So they're saying that it doesn't matter. Second thing is the death rate was very similar as well. So this is the basic outcome of this. So let's look at it. And I would admit right off the bat, my stance is different from the data that you're going to see. So you can compartmentalize my opinion separately, that is Mubin's personal opinion. And someday you can ask me, why do I have that opinion? I'll explain it, but let's look at the data. So over here, Sweden, first of all, Statista. So Statista here shows this is the number of coronavirus deaths in Sweden 2020 by age group. So if you see here, the total deaths that they have reported so far, out of them, 9 years and younger, 1 death. And then 20 to 29 years, 10 deaths. And then 30, 39 and onwards, the number of deaths increase. So really what they're saying is about 1 to 10 deaths in younger children. If you see here, this is the study and the result of that study. In that study, what they're saying is that and sorry, I scribbled some more things over here. In Sweden, during Feb 24th to June 14th, there were 1,124 cases of children's COVID-19. In Finland, 584 cases. And remember that Finland's population is almost half of Sweden. So if you double it, they almost become the same. Then the percentage of the cases in children out of total cases in the country for COVID-19. Sweden had 2.1% of the children out of all the cases, and Finland had 8.2% of the children getting sick out of all the cases of COVID-19. Out of all the children in the country, the Swedish population, out of all the children, the number of children that became sick was 0.05%, which is the same percentage as in Finland as well. So keeping in mind that one country did not lock down up to 16 years of age and the other country had a lockdown. So what they are proving in this study is that lockdown or no lockdown, children in the school or not in the school, lesser than 16 years of age, it did not, number one, and most important thing here, deaths zero. Although Statista shows a different number of deaths, but anyways, that study shows zero deaths. So what they're saying is that number one, children at home or in the school had or caught infection at the same rate. And secondly, there were no deaths. The third thing that was interesting in this study was this: outbreak investigation in Finland has not shown children to be contributing much in terms of transmission. And in Sweden, a report comparing risk of COVID-19 in different professions showed no increased risk for teachers. And then they have data here as well. So if you would like, you can look at that data too. So that is the data over here. Finland, total number of schools, number of pupils in the school. So about 1 million students in Sweden, 500,000 in Finland. And then the percentage of incidents. And if you see here, number of deaths, 1 to 5 year daycare, number of admitted to ICU, 0, number of deaths, 0. And similarly, 6 to 15 years, number of deaths, 0, 16 to 19 years, number of deaths, 0. So that is the comparison. So from this study, the takeaway is that lesser than 16 years of age, neither are they spreading to their teachers, nor are they dying from it. Yes, they are catching the infection. Now, my personal opinion over here, it is impossible for someone to catch and not transmit. Yes, one thing that is interesting is that if I am mildly symptomatic, then I will not be coughing a lot. I will not be sneezing a lot. And possibly then I will not be transmitting a lot because I'm not just throwing the breath out with force. That doesn't mean I cannot transmit. So anyways, this is the study. I take it on its face value because it is by the health ministries of both countries. So I'm hoping that they are not, misguiding us. So with this, let's go to some more. I had a challenge on YouTube by somebody. Somebody left a comment saying that you are wrong in saying that 0.2% is the death rate in children. So I wanted to make sure that I present that data as well. And so here is this is Worldometer, age of coronavirus. And if you see here, so this is the death rate of all cases and death rate out of confirmed cases. And the link is here, and this link is in description as well. So if you see here, 0 to 9 years of age, no fatalities. 10 to 19 years old, 0.2%, global 0.2% fatalities. 20 to 29 years, 0.2, and then you can see the rest. So when I have my, when I use 0.2%, here you can see that data. And again, I'm not making it up. It is here in the Worldometer. You can go and check it out. Back here then. Continuing, what I want to do is I want to compare and contrast some of the countries. I could not go over every single country, but I wanted to look at some countries from where the data has been coming. So China, Feb 11th, till Feb 11th, 44,672 cases. And then out of them, 0 to 9 years of age, 0% deaths, no deaths. 10 to 19 years, 0.2% deaths, which is, if I took that percentage and use this as the cases, so 90 deaths. Then 20 to 29 to 0.2%. What I then did was, instead of looking at the percentage death from the percentage of cases, I wanted to see the deaths out of all the deaths, the percentage of children's death out of all the people who died. So in China till Feb 11th, 1,028 people died. Out of them, 90 were children. And so that is 8.75% of deaths out of all the deaths. So in my opinion, that is a high rate. For me, even one child's death is a tragedy. And I've said it many times, so I'm sorry if I keep I sound like a broken record. United States, February 1 to June 17th, 103,339 deaths. Age lesser than 1, 8 deaths. 1 to 4 years of age, 5 deaths. 5 to 14, 13 deaths. 15 to 24, 125, and then 55 and onwards, 690. I think this was 25 instead of 55. So my apologies. Make this 25. So 699. So here in the US, this percentage is out of the total deaths. And we unfortunately in the US had a lots of deaths. So you can look at it from percentage and then say that if you round it up, it is actually not much. But also look at it from this, that who would be able to tolerate a child lesser than 1 year of age to die? And I feel that this is disingenuous, that when somebody says that there are children dying for other reasons too, so what's the big deal if they are dying like this? And I can actually show you a site that said this. So it's not just me here. Look at this site. Coronavirus COVID, American Council on Science and Health, deaths in US by age and race. And what they have done is they had, so if you respect them, that is totally fine. For me, this is not the best thing to do, to say, look, in this age group, we have 6,157 people die, children die. So what if 8 died? So I just, this is a new thing. It is comparing it to the roadside accidents and other flus and other things. Look, these were the things that were already there. Do you think that we should let them be? If there are roadside accidents, shouldn't we be working to figure that out as well? And this is a new incidence now. And if the world is focused to fix it, I don't find a problem with that. The only problem I find is that the world actually knows now what are the things that work, and we are not adapting them correctly. And so this issue just continues to go on. But I do not appreciate this kind of a stance. But again, that is my opinion. Maybe there are people who can take another stance, and I would like to know that they have their own children as well, and they are okay with that stance for their own children too. Back here. So United States actually has deaths where other countries have said that no deaths in that age range. They have a little higher death rate. And the reasons, I have to still look at the reasons. We have done the discussions about children many, many times. Today, I just wanted to go over the mortality to kind of be on the same page. If your opinion after this is that somebody is okay with it, then they're okay with it. I am not. Italy. So if you look at Italy here, this is the Italy's data that I used. And what they reported was till August 11th, total deaths, 35,463. And then 0 to 9 years of age, deaths were 36. That is 0.1%. Then 10 to 19 years of age, 0 deaths. 20 to 29, 36 deaths. And then 108, and then it continued on. So that is Italy. So again, in Italy, there are deaths in this range. So there are deaths. United Kingdom, that was an interesting situation because I kept Googling and trying to find the United Kingdom's mortality rate with COVID-19 by age, and I could not find it. So I am, maybe I'm wrong, or maybe I did not do the correct Googling. But anyways, this is one thing that I found, and I'm using this data from here, and that is the Guardian. And from the Guardian, I took this data, which they say 5 under 18s have died of COVID-19 in the UK during the pandemic. And then they're saying in all, 71 children ranging from 1 to 17 have been treated in pediatric intensive care units. Out of those 71, 5 have died. So I then just kind of collected some data. Total deaths in the UK, 41,477, 71 serious COVID-19 cases in children, 5 out of them died. That is 0.012% of all deaths. So all those folks, unfortunately, who died, out of all of them, the children's death is 0.012%. But once again, when we look at percentage, sometimes it seems negligible. But when you look at this individual cases, 5 children, I have 2 sons. So, and I did not find ages of the children as well. So if somebody has this data, please put the link there in the comments. Then the worldwide death rate is what I just had shown you here as well. That was this one. Sorry, worldometer here. So this was the data that I was showing you. So that is the discussion for today. I wanted to once again keep this one short as well, just so that if you can share it. Now, out of this, whatever is your opinion, I am fine with that. That is your opinion. I respect that. But my opinion is now very clear. I have shown some data as well. So I know that some people are going to look at that data and say, yeah, it is okay. Children should go to school. I also heard a comment, saw a comment where somebody said, you have to send the children to school so that they can help develop the herd immunity. How many children are we okay with if they died during that process? And I have the same stance when some people in the beginning have said that it is okay that the older age folks are becoming, they're falling more to this disease. And there were some cruel comments in that category as well. I just don't think that these are fair comments. So with this, we'll stop today. Now, tomorrow, Dr. Subhashri from India is going to join us. She's going to talk about Indian population. She's going to talk about the nutrition status, especially vitamin D. So she's a nutritionist as well. She has done a lot of research on vitamin D. So she's going to be with us tomorrow and we will talk about vitamin D. And day after tomorrow, we'll do the open forum. So the open forum was supposed to be tomorrow, but Dr. Subhashri's interview came up. So we'll move the open forum to Saturday. And finally, one topic selection that I think we should do, and it is not in the news, it is nowhere else, and that is inflammation. I feel that we know the immune system's dysregulation very, very much now. It is on our fingertips. We'll know more about bradykinin as I discuss the drugs that would prevent the bradykinin storm as well. But one area where we all are still not very much up is the process of inflammation. That is when the damage occurs, what happens in that area. And that is very important for us as well to understand another dimension of how COVID-19 can be managed. So if you are okay, next week we will also talk about inflammation too. So hopefully this was interesting. Please, if you liked it, like, subscribe, and share. And I would see you tomorrow with Dr. Subhashri. If you have any vitamin D or nutrition questions, please put them on Twitter or here, but it is actually useful if you can put them on Twitter. Of course, we'll answer some questions from the comments here as well. So with this, please stay safe and protected, and I'll see you tomorrow.